Hi everyone and welcome to this very short session on naloxone administration. So my name is Nathan Smith, I'm Navigo's trainee ACP in the Dual Diagnosis Service, which is a pilot scheme between local mental health provider Navigo and substance service provider We Are With You, in which we provide dual diagnosis support. So this session is going to look at the signs of an opioid overdose and what to look for. We're going to look at naloxone, how it works and its limitations. We're going to go through two different administration techniques. So we're going to look at injectable form and nasal form. And we're going to look at what to do before, during and after administration of naloxone. So what is naloxone? So naloxone is an opioid antagonist which temporarily blocks opioid receptors, specifically at that opioid receptor, and it's designed to reverse that respiratory depression. Quite textbook when you're looking at an opioid overdose. It acts quickly, depending on the administration route, between 1 and 3 minutes, but it does wear off after 20 to 30 minutes, so it does require re-administration. It only works on opioids, so if you're administering naloxone, you're thinking you're supporting someone who's experienced an overdose of heroin, methadone, morphine, codeine, fentanyl, tramadol, etc. Locally, we're seeing more illicit substances which are being laced with synthetic opioids such as nitazines and fentanyl, increasing that risk of opioid overdoses in medications and substances which you wouldn't normally expect to see opioids. It's safe if you give it in error, so there's no negative side effects if you give it to someone who isn't having an opioid overdose, and it's an emergency measure used to restore that breathing until proper medical assistance arrives. So, recognising an opioid overdose, what are you seeing? So you come across someone who is really sleepy, the consciousness levels are fluctuating, they could potentially be unconscious. When you're listening to them, are they choking? Are they making some gurgling sounds, which are not explainable by anything else? When you touch them on inspection, are they cold? Is the skin clammy? When you've looked at their eyes, are they small, are they constricted, are they pinpoint-like? The skin, you'll see a real sort of textbook cyanosis in a respiratory depression associated with an opioid overdose. So you'll see blue lips, fingernails, extremities will be blue. Due to that, deoxygenated blood getting around the body. The person, are they dizzy? Are they quite confused? Are they disorientated, which you can't explain? It's not really out of character. For me, what we're trying to reverse, that slow and shallow breathing, which indicates that someone's at real risk of respiratory depression. The respiratory system's under a lot of distress, and when we use opioid reversal such as naloxone, that is what we're trying to reverse whilst medical assistance arrives. So, two different forms that we're going to go through today. So first we're going to look at the injectable form, which is the Pranexad. Pranexad comes in a little kit like this, issued by local services such as We Are With You to family, carers and other professionals working in substance-related industries to try and reduce those opioid-related deaths. So the kit comes pre-filled. So in the kit you get 2 needle tops and a pen. So the pre-filled syringe, which comes with 5 doses in. It's used to reverse that opioid overdose, as I say, by blocking that opioid receptor. It's licensed in the UK for the use by lay peoples who have had the training. It's an injectable form, as we've mentioned, which gives a quick administration. So 1 to 2 minutes, you should see a positive effect of administering that naloxone. So, administrating the IM. So what we're doing, so step by step, you call 999. Using naloxone does not negate from the fact we need emergency support. So I would always recommend you call 999 first before administering naloxone to get that support on the way. You check responsiveness and the breathing. Give rescue breaths if you need to. Do your basic CPR. Do your basic first aid. Do an assessment, what you're needing to do. Remove the cap and needle cover. Ensure that solution in that pen is clear and colourless. Inject 0.4 or 1 dose into the either thigh or upper arm in an IM technique. Repeat this every 2 to 3 minutes. If you're not seeing an improvement, do it again. Up to your max of your 5 doses or your 2 milligrams. Continue rescue breaths and monitoring until help is required. It is quite simple in those situations, it's really scary, but if you just remember the fact you've got 5 doses in there, you're using them every 2 to 3 minutes, depending if you're not seeing the presentation. And remember, using naloxone when an opioid overdose is not at play causes no negative effect. Alternatively, which some people prefer in my opinion, just because they're not as invasive, is the nasal form. So nasal form license is called the Nixoid. They come in a box of 2, but that is one kit. So you've got 2 of these nasal applicators in the kit of 2. Again, they're used to reverse that opioid overdose by knocking off those opioid receptors. It's licensed again in the UK for anyone who's had the training, and they just feel really sort of convenient, quite safe. Keep them in your bag and just use them if you need them. Step by step for the nasal administration, same as the injectable form, you're ringing 999 first. Advising that you're suspecting an opioid overdose. Check the breathing, give those rescue breaths if not. If they're breathing normally, put them in the recovery position. Peel open that blister pack, remove the spray, support the person's head, insert that tip into the nose until one finger is sort of supporting the nose. Push down on that lever. As you push down, your thumb or whatever finger you've got in that sort of administration zone will then touch that person's skin, and you'll know that you've administered the dose. Press the forward plunger down, which gives the one spray 1.8 milligrams of naloxone. If no response, use your second kit. You come in with 2, but always, if you've only got 1, use the 1. But keep giving those rescue breaths, monitor them until help arrives. Use the recovery position if they're breathing. So after you've administered naloxone, what are my sort of bits of information I would like to share? So always call 999. Naloxone is short acting, 20 to 30 minutes. It's temporary. An overdose may return if it wears off, so always ring 999 first. Monitor the breathing and consciousness, give rescue breaths, do basic CPR, and continue with no improvement after 2 or 3 minutes. If your naloxone works, it's effective, so you are supporting someone who's had an opiate overdose, expect withdrawal. So you're going to see agitation, vomiting, sweating, aggression. Reassure calmly, please, your safety is paramount. If you cannot safely reassure that person, step back, watch from afar, and just report to emergency services what you are seeing. Use the recovery position if they're breathing, but unresponsive. If they're not breathing, continue with CPR and rescue breaths. Stay with the person, but like I say, expect agitation, step back, completely remove yourself if needed. Hand the kits or your injections to the paramedics when they arrive. Try remember when you administered it, just so they can hand over to the hospital on their arrival. Encourage follow-up support. So you've come across someone who you suspect is having an opiate overdose. What support are they getting? Are they getting any? Do they need onward referral to somewhere like myself, dual diagnosis support, or do they need follow up with a GP or local substance services for sort of some interventions around their substance use? Could be formal sort of an intervention package such as rehab, but it could be something basic as harm reduction, bit of education, which is available locally. Why am I asking people to learn how to use naloxone? So locally in Grimsby, nationally, in 2023 we had over 5,000 drug-related deaths. 47% of those contained an opiate. The figures always are in the north, historically has been and continues to look like it is doing that. But local data, which is available on the Office of National Statistics, show that North East Lincolnshire reported 38 drug deaths in 2024. 5 years before that, our figures was nowhere near that number. So in 2023, it was just 17. 2022, 18. 2021, 16. 2020, 9. 2019-13. So having 38 drug deaths with an average sort of 47% occurrence of an opioid gives us about 19 instances of an opioid related death. Locally and nationally, we are seeing a massive rise of synthetic opioid overdoses and deaths associated with this. So these are sort of recreational drugs such as ketamine, cocaine, ecstasy, ordinarily not containing opiates, are being laced with nitazines and fentanyl. So synthetic opioids, which are quite very potent when you think of fentanyl alone. So they increase that risk of respiratory depression and death. So just to recap this quick session, so we've explored the science of an opiate overdose. What does it look like? We've discussed what naloxone is, how it works, and what receptors it acts on. We looked at two different administration techniques, so I went through briefly the IM route, so the pre-filled injectable pen, and the nasal, so your Nixoid nasal kit. We looked at local data and explained why this is so important. What I would just say, so onward referral for me is key. Keep that person safe, but onward referral is key. Let's break the cycle of opiate use on substance use and use our resource. So locally we are with you for local substance support. Navigo using that joint pilot scheme of the Well Together service. But any questions, or if anyone wants to have like a one-to-one teaching session, if they're really quite anxious about administrating naloxone, please email me and I'm happy to support with that. I would much rather someone email me and say, Nath, I'm not sure on the administration. I'm supporting someone who's talking about using opioids. Will you go through it with me? And I will absolutely endeavour to do that. But any questions, like I say, email me on n.smith46@nhs.net. But thank you for joining me.